Bismillahirrahmanirrahim. This is Dr. Ghufran Babar. I'm a pediatrician and endocrinologist in America, and you are watching my YouTube channel. Today's video will be on COVID-19 updates from US and across the world. Starting with the US first, US continues to have a lot of cases. In last 24 hours, the latest updates are that we have close to 200,000, 198, almost 199,000 people dead, with 6.6 million cases and 9,000 very serious patients. As far as the state review goes, New York is still leading the death count, which is up to 33,000. Daily change has been plus 1%. Total number of cases is almost 4.4 million cases. 443,000 cases. In New Jersey, the death count is 16,000 with almost 200,000 patients. California is on the number 3 with 14,334 deaths. Then is Texas with 14,332 deaths, and then is Florida with 12,600 deaths. As far as Texas is concerned, last 24 hours there has been some decline, minus 7.5% in the new number of cases, versus Florida is also minus 2.6. In Massachusetts, there are 9,000 deaths, almost 9,200, with a number of new cases in the last 24 hours plus 5.2%. So the disease is still here. So a lot of cases are coming up in the colleges. Almost 50,000 COVID-19 positive college students, as the colleges have opened up. And they socialize. Sometimes they are not careful with terms of preventive measures of social distancing, hand washing, mask wearing, sometimes gatherings which are large, so that has contributed. And they have been asked to quarantine locally, sometimes in the hotels, so that they don't spread the illness to the community if they go back to their respective homes. Dr. Fauci, has said that this winter and autumn and winter would be a big challenge, and hopefully, there will be less deaths. But the projection is, if the similar rate of spread is happening, it could be up to 300,000 by December. And as far as the Oxford vaccine trial is concerned, it was temporarily stopped last week. Because there was a patient with transverse myelitis in UK, and this is the Oxford AstraZeneca vaccine. So the transverse myelitis is a kind of an autoimmune reaction, and remember, this AstraZeneca and Oxford vaccine is a adenovirus vaccine, and sometimes autoimmune phenomena is that the body tries to mount the immunity, say against the vaccine viral antigen, and somehow those antibodies and the immune cells, the natural killer cells, they can damage our own cells. So that is called the phenomena of molecular mimicry, that the antigen of the virus resembles our own cell structure. So those antibodies then bind to those areas and try to cause inflammation and destruction. So in transverse myelitis, spinal cord is involved. In spinal cord, there is the nerve cell bodies, nerve fibers, and on the nerve fibers or the axons, there is nerve sheath, which is the myelin sheath, and myelin is produced by the Schwann cells, which are specialized cells. So this myelin sheath is destroyed in transverse myelitis, and it affects transversely the spinal cord. The spinal cord has the messages coming in the form of tracts or ropes of fibers which are anterior in the front of the spinal cord and posterior at the back, and there are no autonomic nervous system that controls some other vital organs. So the anterior or the front of the spinal cord is responsible for carrying out the motor functions like moving of the muscles, movement of the muscles. So if you lose that, you may have weakness or which is paresis or paralysis or loss of function of the muscles, or increased tone may happen. In the back of the spinal cord, there are specialized sensory fibers which are taking information to the brain, and when that is impaired, you can have loss of function, you can have backache, you can have loss of touch sensation, vibration, proprioception, which is the position sensation, and the autonomic nervous system, which is taking information from the bladder and then innervating the bladder and the bowel function. So you can have problems with the sphincter control, you can pee, or you may have the urinary retention, which can also happen. And depends, transverse myelitis or inflammation of the spinal cord happens at what level. If it is upper cervical cord, it could affect all the four limbs. If it is in the middle, it could be thoracic. So you can find the level by a careful neurologic examination. If it is at the cervical level, you can have even respiratory paralysis because of the involvement of the nerve that supplies the muscles of the chest and the diaphragm, the phrenic nerve. And lower down, if it is say the nerves of the back, it can affect the legs, and the nerves that supply the rectum, our anal sphincter, urinary sphincter, we can have loss of those controls. So it is a self-limiting disease, so that patient started getting better, and the vaccine trial, which was stopped, has been restarted, which is a good news. So hopefully this patient completely recovers. Long-term treatment is physical therapy, and over 3 to 6 months complete recovery. Most of the recovery is possible with some residual weaknesses, and it is an autoimmune response. So no one is immune to autoimmune diseases. Some people are more susceptible depending upon their family history, or if they have already have an autoimmune illness like lupus, diabetes, thyroid disease. So this vaccine is already under manufacturing process, and a lot of amount of vaccine is being prepared as the phase 3 clinical trial is going on, in which about 30,000 people are taking part. So let's hope that there will be less interruptions in the vaccine trial. And the question is, would this vaccine be available before 3rd of November, the election day in US? So chances are low. They were trying to bring it out, but these vaccine companies, they have signed a contract that they will not expedite unnecessarily the vaccine synthesis or production. 62% of US population, based on a US survey, is they're concerned about the safety of the vaccine if the vaccine manufacturing is expedited too much. 54% of the people said they will not vaccinate themselves if the vaccine comes before 3rd of November, meaning they don't want to take a chance. And I don't blame them, because you want to be sure that the vaccine is safe. So until good data comes out of the phase 3 clinical trial, it is advisable to wait and not over expedite the manufacturing of the vaccine, considering any possible major side effects. Remember, the phase 2 clinical trials, they included, as well as the phase 3, 2 injections which are 4 weeks apart, and major side effects were fever, tiredness, headache, depending upon the dose of the vaccine given, and local reaction. So no major side effects were seen. Saying that, phase 2 was on a small population, and phase 3 is on a bigger population, so you may witness more side effects of the vaccine. So these were the US updates, and hopefully we hope that this vaccine manufacturing process continues to get better, and vaccine is available by the end of the year. Dr. Fauci has said that we are looking into this epidemic or pandemic may end by this time next year. So we are looking for another year of this pandemic. It may worsen during the autumn and winter before it gets better. So please get yourself and your family vaccinated against the flu virus, because you don't want another confounding agent on top of COVID-19. As far as Brazil goes, the deaths have been increasing. They're up to 131,274, 4.3 million cases, 800 seriously sick. But the bigger worry is India, which is now the second in terms of the number of cases, with 4.8 million cases and 79,000 deaths. And a lot of people, over 8,000, are critically sick. And the people in India are saying that these numbers may not be exact, as the data is not reported as accurately in India, Pakistan, as is in US and other developed countries. So the death toll may be higher than 79,000. The number of cases may be higher than 4.8 million. So India appears to be the next epicenter of COVID-19, with people which are over 1 billion population. So understand, there are over 1 billion population compared to US, where about 300 million people live. So there is a bigger catch, more poverty, less health facility, more condensed population, greater chance of transmission. So unless the cross immunity against other viruses helps people in India, we are looking into a big death toll. But time is going to tell how things will go. People, they are increasing the number of the deaths. The vaccine preparation in India is going on, as well as they are trying to enforce other preventive measures. But at this time, the things don't look good. In UK, there are 41,600 deaths already, 3.6 million cases, and less severe critically ill cases. But there are still pockets of cases, and UK has developed an app to find out the contact tracing. So if a patient is there, they will try to make assumptions where this patient was, and to isolate the population so that the spread does not happen. The rule of 6 is being enforced, meaning not more than 6 people in a gathering, outside or inside the home, and preferably 6 feet away. It's the students as across UK as well. There are a lot of students who are becoming COVID positive. Again, they are young people. They are not getting serious illness. However, they are being quarantined locally so that they don't give it to their families or adults or elderly when they go home. And there is a saliva and swab test which is available in the market, which can give results from 20 to 90 minutes. And a thought has been started that, okay, before any soccer games and cricket games, people could have the saliva test before they can go in. And if the test is negative, they can go in. But again, who wants to wait 60 to 90 minutes outside waiting for the test result? So that is about UK. Pakistan continues to be showing good results. The deaths at this time are 6,379, and total number of cases about 300,000 or 0.3 million, and seriously sick patients at 534. So good news coming in from there, and the cross immunity is protecting the people. A lot of people who develop COVID-19, based on research in Aga Khan Hospital in Pakistan, says that most of people have no symptoms. So that's interesting, that although they get the COVID-19, but because of the cross immunity, probably they don't, the severity of infection is not severe, and they just get off the hook by very, very mild infection, or literally no symptoms at all, which is good. Australia is doing well. They are doing the preventive measures. Victoria, which had a lot of cases, they are also going down. So overall, the number of deaths may be going down, but a lot of new cases are coming up, and the fear is that India would be the next epicenter, may overtake US in terms of the number of the deaths, but time will tell how the disease progresses. Just like US, it's a big country which is condensed and more thickly populated per square mile, and with people who are very poor. They live in small communities where social distancing may not be possible. The health facilities are not good. Ventilator facilities may not be available in government hospitals. So we can hope and pray that people all over the world, they get better. Those people who have gotten the COVID-19 and those who are not infected don't get it, and vaccine comes soon enough by the end of this year, which is safe and effective, and over next 1 year life gradually comes back to normal. Please like this video, and please subscribe to my channel so that whenever I make another video on a weekly basis, you are able to watch it. Share this video with your family and friends, and best of luck. Sallallahu alaihi wa alihi wa sahbihi wa sallam. Thank you.